The Community Information Exchange is made up of members. Are they all clinical?
Right now they are. They're all clinical in nature. They're distinct organizations, so they're not affiliated with BMC, at least from a financial perspective. But they are all small community health centers or community hospitals in nature, and they have basically clinical relevance to them.
How long did it take you to establish that organization and to get all of those disparate systems to start talking to each other?
So it was actually about a year and a half, I'd say. We initiated it with funding from a grant that we won from the federal government, and we began to speak to our community organizations to talk about how we might create this sort of exchange, this community exchange. And many of them thought it was a no-brainer. Of course, there was periods of time in history where they didn't want to exchange data. There's always sort of the political issues that you have to overcome. But once those organizations realized that exchanging information and collaboration to benefit patient care was a necessity, it became an easy discussion to have with them. And we really got to the point where we were talking more about, once we exchange this data, what are the things that we need to do to show that we can sustain it, to show there's value? And that's how we really landed on Fusion FX and Carefx e-referral project or portal.
So you're actually talking about meaningful use and receiving the stimulus funding. You mentioned that it was improving your bottom line at Boston Medical Center. Is it having the similar effect with all the members in the community?
I would say it is, and in the way that it's really streamlining their process, and so their ability to communicate with Boston Medical Center as they send patients over to us has become very seamless. In the past, it would take them much more significant time to really, believe it or not, send an order, a referral over to Boston Medical Center, and now it's within a matter of days. And they also get a response back from BMC when the referral is completed, which never happened before. You would often have a physician scrambling and looking and searching themselves to find out what happened to that patient at that referral. So there's a lot of sort of process and workflow enhancements that they've seen, but also it's sort of the quality of care. So they now are able to ensure that they're providing, along with the patient, as the patient goes to BMC for the specialty visit, the appropriate information so that the specialist provider who is going to be giving that care knows exactly what to do for that patient, not to be redundant in terms of their procedures or labs or what have you, but just really get to the crux of what needs to be done for that patient.
Sure, it sounds like that's going to have a benefit nationwide as more and more organizations adopt that strategy.
Yeah, I think so.
Since we're trying to lower the cost of healthcare overall. What about medication reconciliation? Are you working on that as well?
Yeah, so the medication reconciliation piece is really our next step, and my hope is to be able to do that with Carefx. I think they have a very good solution when it comes to sort of the referral management process. I'm sorry, the med reconciliation process. So we are right now aligning our sources of data to begin to create that environment so that we can put on top of the CIE that medication reconciliation application that Fusion FX is offering some others across the country.
Okay, thanks very much, Joel Vengco, Boston Medical Center. It was very nice speaking to you. Thanks for coming.
My pleasure. Thank you.